Uh, what up, guys?
Yeah, just
I'm Ajaz. I'm also a third year medical student, and basically today we're going to give you a talk on how to ace neuro, inshallah.
yeah,
Uh, it's a very, very, very interesting block. It is
yeah,
much 100 times better than POD. It's not just senseless memorization, uh, like most of POD is. It
hmm
is more
and it's very,
focused.
very
Mhm.
organized. Very much
It's
like it's
much more organized. You
much
have
more
actually you
organized.
actually have times to study, unlike
hmm
POD. And even though the lectures are a lot, you guys have a lot of time. You guys have even more time than we do. You guys have an extra week.
Yeah.
So inshallah, let's go through the presentation, and
Okay.
we'll give you some tips
So
on how to do it.
yeah. So first of all, this is as يعني شايفين, neuro is where real medicine begins. And no, that doesn't mean everything you learned was useless right now. What we're saying is that neuro is where you actually get into some clinical stuff, okay?
Mhm.
So you're going to be introduced to certain subjects that you haven't been exposed to before, like clinical, which is now known as neurology,
Mhm.
along with radiology, which you also haven't taken before other than parallel, and psychiatry. Now, the reason why we refer to it as real medicine is because you'll be taking basically the normal of everything as you were taking before, pathophysiology, which is kind of, yeah, you've taken some patho before, especially in POD, yeah. But now you'll also be taking clinical presentation and diagnosis. Okay, so this is going to be mainly in clinical. Okay, so you're going to be talking a lot about how the signs and symptoms are for certain diseases. You'll
Mhm.
be able to understand how to identify certain diseases from the clinical scenario just based on the clinical features and lab investigation. So you'll actually be asked about these sort of things. And for example, for this disease, how do you identify it through lab investigations? What are the hallmarks? What are the features of it? Okay, so
Yeah.
this will all be covered in pathology and clinical kind of.
Yeah.
You're going to find a lot
The
of
the
repetition in both.
yeah. The main block that comes close to this, Yani, is like in similarity that you've taken before is MSK, more or less, because it's also very anatomy focused. And but obviously there is much more. Like in MSK, also you had like clinical scenario that he fractured his arm, which nerve is damaged,
Mm-hmm.
stuff like that. But like now it's much more of the clinical and less of like the basic stuff that you guys, the normal
Yeah.
structure and function that you learn. It's more the clinical scenario that a man
Mm-hmm.
cannot walk, which part of the brain is affected, stuff like that. Okay, we'll
Yeah.
get into it. We
Also,
have
if
some
you realize,
examples.
sorry,
Mhm.
Jeff, yeah, if you realize, in third year, you're going to be taking the same blocks you took before, but pathology. If you notice in their courses, you don't take neuro again. You only take it this time, and then you're not going to take it in third year because basically what can happen is that you're going to take the pathology of neuro within this block. Same thing with
Mhm.
HNS. Okay,
Yeah.
so that's why I'm saying it's where kind of you begin to get into real medicine, and it's going to kind of tell you how third year is going to go be like because
Yeah.
third year is going to be all pathology, clinical, radiology, micro, and all these sorts of new subjects. But like we said, it's enjoyable, it's organized, yani, inshallah you'll like it. Okay, so again, these are the subjects that you'll be taking. I know it's a lot, but yani, trust me, inshallah, you'll find that a lot of them yani, complement each other really well. So it's going to be easy for you, inshallah, if you study yani, and work hard enough. I don't want to make it seem like it's so easy, by the way, because it's not. But it can be. It's very manageable. Okay, you just need to study day by day. Okay, you still have to do the day by day thing. You still have to put in a lot of effort, but it's still manageable and it's enjoyable. Okay,
Yeah.
so approach to anatomy. Now, anatomy is a huge bulk of this block. Like all blocks, usually there's like this one subject that's the main subject for that block. For neuro, it's anatomy. Anatomy is definitely one of them, basically.
Yeah.
And it's
So
going to be taught
basically, if
by,
you have, if you
yeah,
sorry, Rowan, if basically if you have 100 questions in your final, 45 to 50 questions will be anatomy. Like if you know
definitely.
anatomy, you can answer
Mhm.
half of the exam. Yeah. So it's the
Exactly.
most one of the it is the most important part in neuro is you mastering anatomy. And how do you do it? Rowan will tell you more about it.
So basically, what Ijaz is saying, don't skip anatomy, okay?
Yeah. Yeah.
Um, So it's taught by two professors, Dr. Yaqeen al-Din and Dr. Akif. Now, for Dr. Yaqeen al-Din, like his lectures, you seriously need to attend them, and especially the brainstem ones. Okay, like if you can't attend some of them for some reason, you're asleep or you can't focus, attend the brainstem one. Okay, and trust me, his lectures are يعني very well explained, and he mashallah explains it so good. He makes you understand the concept in class very well. Um, and he says a lot of the important stuff in the lecture. So he'll tell you a lot يعني, about things that you need to focus on. He'll focus a lot on something that he wants to bring. So you'll get the idea of what to focus on, you know? So even if you don't attend the lecture, you have to watch the video for it. Like you need to see him explain, and like how, especially with the pathways and everything. Because you know, anatomy is very visual, okay? So you need to really get it. There's going to be a lot of stuff يعني زي visual زي spinal pathways and the brainstem itself. These are 3D structures that have a lot of overlapping things that you need to know. You need to be very well oriented with their positions, because as you're going to find the questions, they're not going to come in, oh, what does this do? Where is this heck? لا. They're going to be like, oh, there's an injury at this site. So you need to know all the places that are in that site. So you know how, what the effect is going to be, what's the result of the injury. You get what I mean? So yeah.
So
So
what
don't be
basically
fooled.
Rowan is
Yeah.
trying to say in like a nutshell is for Dr. Yahinuddin, first of all, don't skip any of his lectures. Second of
Mhm.
all, everything that he says in the class, he will ask about it. 110%. He has given us basically in class, he gave us, I think over the 12 weeks, he gave us 30, maybe 40 clinical scenarios, right? Like he explained the scenario to us. Oh, this guy is
Mhm.
like he is not able to speak. This part is damaged. Okay. So he will bring that exact same question in the exam. He will not even change a single word. He'll bring the exact same question in the exam, or he will bring the same question but a different part is damaged. All right, so for sure, whatever like clinical scenario that he says, a patient presented like this, you memorize that word for word. All right. Okay.
Yep. And then we mentioned basically brainstem. You obviously you've heard a lot about how difficult brainstem is. I'm sure people told you it's difficult and all that, blah blah blah. It is hard, yeah. But honestly, the best way to master it is to just keep repeating or use the resources that we're gonna tell you.
Yeah.
And like I said, it's trust me, it's manageable. And for Dr. Akif, I'm pretty sure you've taken with Dr. Akif before. So you know how Dr. Akif teaches and all his questions are from his transcription. You just need to
Yeah.
focus on what he says in class, and he focuses a lot on the clinical relevance of everything. Another thing this point will tell you about later, and specifically with a picture, but to know you need to memorize the number of the important areas in the. Oh, okay. My voice isn't clear. One sec.
Rowan, are you using AirPods?
Yeah, that's
That's the
why.
reason.
Okay, wait. خليني it's dull شكل. Okay, let me disconnect from my earphones.
Okay. Up till then, I'll continue. All right.
Okay.
So Dr. Akif, you guys have seen him. He's gonna come into class. Make sure that everything's ready for him so that he's not in a bad mood. Make sure you guys are well behaved. If you're if you make him angry, he does sometimes like he's very like be very respectful in class, basically, for Dr. Akif particularly. That doesn't mean don't disrespect. That doesn't mean disrespect other professors, but for Dr. Akif in particular, be extra respectful. But and also, he's gonna come in. He's gonna give you a very short lecture. You just have to transcribe it, or you can wait for his transcription and just memorize whatever he says in class, because his transcription will be a lot of stuff a lot of details that you haven't taken. But whatever he says in class will be what's asked in the exam. All right.
Yeah, pretty much. Um, okay, so is my voice clear now, by the way? It's clear. I can't see the chat, that's why I didn't see.
Yeah, it's clear. It's clear. Around
Okay.
settings.
Okay, and yeah, if you didn't miss the thing, it's obviously study anatomy day by day, guys. If you're gonna skip something, don't let it be anatomy, yani. We'll tell you what to skip later. Okay, so this we want to give you an insight to how anatomy is going to be presented to you when you start the lectures. Now, don't be overwhelmed. We're going to go into the next few slides are, yeah, they might seem very heavy and there's a lot of things that you don't know or you're you're just going to get to know them now. But يعني, we'll try to explain things as simple as possible and not go into much detail, because obviously this is not a PAL session. But this is just for you guys to have an idea how to prepare for the lecture, how to approach the lecture, and how to be able to study. So first of all, anatomy will be given to you from down up. What does that mean? You're going to be starting from the spinal cord and the spinal nerves, basically, and then you're going to go all the way up to the central nervous system. So first, you're going to take the spinal cord and the spinal pathways, and then you'll go to the brainstem, cerebrum, cerebellum, basal ganglia, diencephalon, and then limbic system. Okay.
You'll know what these words mean as the weeks go along.
Yeah, you'll know what these are, Yani. So basically, from this list, the least focused on for Dr. Yaqeen Eddin, because he teaches most of this, is the limbic system. He literally gave this. This was his last lecture, and he gave it يعني like heck. He said, "This isn't important. This is a lot." يعني. Like it's very tasleek, okay? So definitely don't focus on it that much. But the first few are definitely very important. I'd say the easiest of them is cerebrum, because Dr. Akif gives it and he makes it يعني it's very simple أصلا يعني there's not a lot to it. But the rest, they're really important. You need to focus on them. You need to attend and repeat, definitely. Make diagrams. Definitely, diagrams are your best friend for memorizing these things, And as you can see in this picture, every word on here, you're going to understand it by the end of Neuro, trust me. You'll feel
you
like
guys have 12 weeks.
You'll be
it looks complicated now.
You'll be able to write in your bio neurosurgeon, okay? Don't do that, by the way. Okay, so before we get into the next few slides of Ijaz, he'll discuss that very well. So first of all, for spinal ascending pathways, okay. First of all, before you forget this word for now, okay? This diagram, you see a lot of colors, okay? These are all columns of spinal fibers, okay? They're nerve fibers going up from the periphery towards your brain. What kind of spinal fibers are these? What kind of nerve fibers? They're sensory, because we know in sensory fibers, بياخدوا stimulation from the periphery and they go to the brain for it to be processed, okay? Yeah. So all these are different types of sensory nerve fibers, and they travel in columns, okay? The reason why they travel in different columns, and we have like different colors for them, is because each color has a different function, okay? Or for a different type of sensation, okay? So the yellow ones, they're the spinocerebellar, the red is spinothalamic, and the blue ones here, they're the dorsal column or dorsal column medial lemniscus pathway. It's a long name. You'll know it later. But yeah. Before we move into Ijaz, معلش, these things right here, definitely there it's a takeaway message from the spinal pathways. For every spinal pathway, you need to know these 6 things, and you'll be prepared for any question on this lecture. Okay? Ijaz, continue.
Yeah. All right. Can you go to the next slide, please?
Yeah.
Okay. All right. So basically, this is just an example, okay? You guys don't have to like understand too much into detail or whatever. Just pay attention to what I'm saying. So these are like the 6 things that Rawan said that you have to know. Like you will take maybe 4 or 5 pathways. Of each of the pathways, you have to know these 6 things about each of them, because any one of them can be asked or in a clinical scenario, or even directly if he's feeling like good. Okay. So this is just an example, okay? So you have a spinothalamic tract. So basically you have to know the function of the spinothalamic tract. It's responsible for pain and temperature and light, touch, and pressure. So basically it's the pain coming. Okay, let's just label this side as the right side, this side as the left side, okay? So you feel some pain or some sensation on your right side, okay? On your right hand, for example, okay? And then it comes into your spinal cord, and then this nerve crosses to the left side and then goes to your brain. Okay, it crosses in the level of the spinal cord. Okay, this crossing is different. For this pathway, it's in the spinal cord. From some pathways, it's in the brain, which is in the next slide as an example. So this level, this is the level of decussation. This is the most important thing in that you will have to know 100%, because it's important pre-mid for your pre-mid lectures, pre-midterm, and even post-midterm is most applicable. Okay, so for example, he will give you a clinical scenario that there was an injury to the left side of the patient, and he couldn't feel pain and temperature on the right side. Why is that happening? And now you know, because it was the damage to this part of the spinal cord. Okay, so this is basically like how the clinical scenario will present. Like, oh, there was a patient with a stab wound on the right side or the left side, and he lost pain and temperature on the right side. Why did that happen? So you have to know the details about the pathway itself to answer these questions. So this is what we mean, that it's not just going to be, oh, which tract is responsible for pain and temperature. He's going to ask you, there's an injury, and then what will be the presentation.
Yep.
Right.
Now, before we
Yeah.
move to the next
Okay.
slide, do you guys have any questions about this? Just any questions about what we talked so far? Is it clear? Do you guys حسيتوا إنه you got it شوي?
You don't have to know the details,
You don't
Yani.
know
It's just like an example. Yeah. Okay, clear so far.
Okay, that's nice. Okay.
Okay. All right. So this is basically an example. This is the same 6 things that you have to know. And it's a similar example. I'm just going to go through it very quickly. But what does this do? This spinal pathway, you can see, it crosses at the level of the brain stem, and then it comes. So if there's an injury on the left side over here, you won't affect this pathway. And the function of this pathway is different. It's touch, pressure, and vibration. So if he asks you that there was a left side stab injury, will the right side touch, pressure, vibration be affected? You'll say no, because it's on the other side and it doesn't cross up until the brain. So that's just like a snapshot. It's like very superficial way of looking at it, because you guys are gonna go into much more details and you will know all the pathways, inshallah. You have 12 weeks. It looks complicated now. At the end of the 12 weeks, you'll be like, oh, this is like baby stuff. Yeah, it's not that hard. Okay. So, all right, moving on. Like, this is the example that Yani, I already described it. Like most of the, let me just remove the drawings. So I already described it. This is how, we just put this as an example of a question that could come. There was a stab wound on the left side of the spinal cord. Which of the following describes a sensory defect? Okay, so if it's on the left side, inshallah, okay, I'll give it to you guys, that you guys give me the answer at the end of your neuro block. But it's like, see, but like, if you can explain it, if you can explain the answers, is when you know that you khalas, like you understood the anatomy lecture actually. Okay.
Okay.
Yeah, I think we can skip this because it's too complicated to explain.
Yeah.
So okay. Yeah. Okay, so this is an example. This is a very basic, very basic example. But there's parts. So you see this is a diagram of the brain. Okay, these are for Dr. Akif's lecture in particular. So the brain basically has numbers. Okay, 1, 2, 3. You can see them all present. What these numbers do is that they're anatomical regions. So if you say area 1, you should know that it's in the middle part of the brain. If it's 7, it's on the posterior part. 17 is very like posteriorly occipital. It's called, that's what it's called. But like it's on the very posterior part of the brain. Okay, Dr. Akif will tell you don't memorize these numbers for certain areas. So like 1, 2, okay, let's say 45, 40, 44, 45. All right. These are the Brodmann areas. Okay, those are the anatomical region numbers. Okay, so Dr. Akif will tell you the numbers are not that important. You can just call 44 and 45 by its functional name, which is Broca's area. It's like Broca's area is responsible for your speech. All right. So if Dr. Akif will tell you, you don't need to learn the numbers 44 and 45. You just need to know that it's called Broca's area. Plus, for us, he told us that it is not important, and then he asked us about it in the midterm as well as the final. So I would say do not skip learning the numbers on of the areas of the brain, especially for the specific areas that he pays attention to, which you will learn as you take the
You
block.
don't need to learn all of them. Definitely don't.
Yeah.
You don't need to bother learning all of them. Just the ones that the areas that he talks about, like Wernicke's.
Yeah, the ones that he talks about, and he says that, oh, if this is damaged, there's a disease. Memorize that, because he will tell you, oh, this is damaged. Which number is affected? And you will have to know the number. And there was a lot of people who appealed the questions, Yani, which came. He said that I said it's not important. I didn't say don't learn it. So only the numbers that he focuses on with you. The numbers, the ones that you will know when you take the lectures, that he only like says certain numbers. But like pay attention to them. Right? Okay. Yeah. Let me remove this. Okay. So anatomy resources. We put number 1 as Dr. Najib's videos, but the number 1 anatomy resource should be your transcription in the lecture. You attend the lecture, you write down what the lecturers say word for word. and then you memorize them and repeat them one or two or three times, how many ever times that time allows you to do so. All right, that's the number one. Now, another resource, because some people like to study from other resources to get a different view, especially for brainstem, there's this Indian guy on YouTube called Dr. Najib. He's mashallah, he's like even Dr. Yaqinuddin uses him sometimes. So he's that good. Especially for brainstem, use his lectures if you do not understand it from Dr. Yaqinuddin. If you understand it from Dr. Yaqinuddin, alhamdulillah, like mashallah, you're going to do very well in your exam because you haven't learned anything that you don't need to know, because Dr. Najib goes into other details that you don't need, but you can use him because he's better at explaining. All right, then the first aid, you guys know it, the Holy Bible of USMLE. It has a lot of tables that you can use as anatomy. There's good mnemonics inside it. You can use it because Dr. Yaqinuddin puts like he cuts out a picture from first aid and he puts it in your slides. So like you know that he uses it as well. And then the third book, Snell's Clinical Neuroanatomy, is good for explaining and as well as some questions that they have because Dr. Yaqinuddin also used. So you have these three resources. What's your question? I cannot write and focus at the same time for the love of God. Okay, so Tanya, a very good thing for you is because you have Corona. It's not a good thing to have Corona, but like a good thing about online learning, let's put it that way, is because you can watch lectures. You have your YouTube, you can forward them, whatever. So the first time I would advise just paying attention to the lecture. The second time you take notes while watching it on YouTube, and then the third time you memorize. So this way you do the lecture three times, and notes committee will take care of transcripts. I mean, it depends. I don't know how your notes committee is, but ours
Yeah,
was really good.
inshallah, yeah. Yeah, you'll
Yeah, but
have.
inshallah, they're good. Yeah. And even if they are not, only for anatomy, at least do it yourself. Only for anatomy. For others, like Bismillah, but like for anatomy, do it yourself because it is that important. Okay.
Yeah.
Yeah.
All right.
Moving
And
on.
one more thing. Anatomy is a type of subject where you need to finish the week's lectures before you get to
Yeah.
next week. Okay. So right now
Yeah.
into this week, you don't have that many lectures in anatomy, but you did, yeah, you should be done with them before you enter next week. Okay. You should do that for every week so that you don't get lost because
Mhm.
they're a lot and they can get confusing if you
Yeah.
don't know the one before to هيك فيعني
Mhm.
try to like study
Also, yeah. Also, it's coming later on in the presentation, but there's some like you have labs every week, right? So in the labs, there is one section that is just clinical scenarios, and Dr. Anna usually does it. That it's just you go, yeah, priority is anatomy to finish first, 110%. 110% you finish anatomy first. Everything else you will finish on time. Everything else you can cram in for 3 weeks, 3 weeks, sometimes 2 weeks if you're a good crammer. Anatomy you cannot cram. It's too much to cram. Finish anatomy first. Focus on everything like of the week as you go week by week. Finish anatomy of the week first. Then you finish clinical and or whatever else that you want to finish. All
whatever.
right. Anatomy 100% priority to finish first. But as I was saying, what about like you have labs, all right, and all the labs are all anatomy except for like you have physiology labs, which
I don't think
let's
by the way
not.
they have physiology because
No, they had physiology today. That is
they
all
had it
bad.
today.
Yeah.
Mhm.
So like physiology labs, we personally were not asked about in our OSP, in our SAQs, even our MCQs. There's nothing about them. So I would say study it once, but don't go too much into depth. But all the other labs, which are anatomy labs, 110%, finish the anatomy lecture and then go to the lab. It will be so useful for you because you'll be like, halas, I mastered the subject. I don't need to study it multiple times because in the anatomy lab is just questions and questions and questions.
Yeah, it's cases, and
It's
you feel
cases.
so bad if you don't. Yeah, if you go there and you don't
Yeah.
get what's going on. And let's
Yeah.
say, okay, let's say a case where you weren't able to study anatomy because yeah, things happen, you weren't able to catch up. Try to in
Mhm.
that lab focus as much as you can so that it
Mhm.
feels like okay, you know what's going on in that lecture. Ask the
Yeah.
people around you. I'm pretty sure, yeah, and you might find students who have studied the lecture. Be like, okay, can you just give me a brief of what this is? What the hell is a
Yeah.
cerebellum? عادي, like ask around, like
Yeah.
and just make sure you benefit from the lab. Don't let the lab go to waste. Try to gain as much benefit from it as you
Yeah,
can.
usually like I'm an advocate of like labs are completely useless. Like they're say they're very low yield. Let's keep it that way. They're very low yield. I'm an advocate of that. Like I don't learn much in labs personally myself. All right. But for neuro, I studied anatomy and I went to the labs and I was like, alhamdulillah, like I know anatomy now 110%. Ask me any question. Like I became so confident just because of labs. Like you go into the lab and you're like, oh, this is how they ask questions. This is their approach. Like 110%. Every other block, I would tell you, POD, I would tell you, ignore labs. I would tell you literally every other MSK I did, they told me become lab tutor. I was like, no, I'm not becoming a lab tutor. I can study it by myself. Alhamdulillah, I did it. But in neuro, labs are important. Study the anatomy, go to the lab. That's it. Okay.
Now
Yeah.
physiology.
Okay, physiology. Okay. So you guys had a physiology lecture today, I think. It was Dr. Shawaf. Okay. So you have two doctors that teach you, Dr. Shawaf and Dr. Hamdan. Okay, they're very different doctors. Okay. Dr. Shawaf, he doesn't have a lot of voice modulation. Like you could feel like a bit bored in his lecture if you're not paying 100% attention, right? And like it's very hard sometimes for some people to keep focused in his lectures. It's not because he's a bad lecturer, he knows much about what he's talking about, but like what he does, his questions, he asks from like the most tiny, minute details that you think are like not important at all, that will you will see it as a question on the exam. He will even tell you that, like for example, for us, I'll give you this tiny example. He told us, oh, this topic, like we as doctors, we don't know much about it. It's still under research. And then we go in the midterm and there are two questions on that topic. We're like, you told us that you don't know about it and you're asking us about it. But he was like, Basi was mentioned in the slides, so khalas, you have to know about it. So like for Dr. Shawaf, pay attention to the tiny details. And the slides are like way much like they're all that you need for Dr. Shawaf. Dr. Hamdan is a completely different doctor. Okay, you guys have had some experience with Hamdan, and I think like from what most of you said, the experience hasn't been like amazing. But in neuro, he was really good to us. Okay, because how you study for Dr. Hamdan is that you don't read through all of his slides. I know some of you cannot move past like one slide. I was like that. I couldn't move past. I couldn't go from slide 1 to slide 2 unless I know everything that's on slide 1. All right, but like for Hamdan, you have to learn how to do that because he like the doctor puts information from research papers, case studies, and whatever. But the concept that he wants to get across is very simple, and he will only ask you about that concept. Okay, so he will give you one slide which will explain the concept, and then 7 slides as examples. These 7 examples you don't need to know. You just need to know the main concept. All right, and Dr. Hamdan, for like I don't know if there's any BLCs who are attending the talk, but like tell like badger like trouble your BLCs. Tell your BLCs like please be useful and go to the doctor and tell him, doctor, we are having like some issues with the slides. There's too many. Can you please shorten them? Because we had like very like amazing BLCs. Like Rawan herself was one of our BLCs. There was Noor Yaman, mashallah. They were very good BLCs. The doctor gave us a lecture with 55 slides. That was the one lecture. That was part 1, and then part 2 was 65 slides. We were like, doctor, we can't study this much. It's impossible. It's impossible. And what he did, he's like, okay, I hear you. I understand. It must be a lot. He removed, and the end lecture was 28 slides and then 23 slides. Yes, no, please go to the doctor. If the lectures are very long, tell him, please shorten the lectures. So what he did for us, he shortened the lectures, plus he highlighted the important parts that he was going to ask about. So if you tell the doctors, they will help. Some doctors will help. Okay. So yeah, and then there's another point that we have a person called Dwight Shandi. He's really he made a lot of summaries for physiology, and we linked them in the presentation. And they're very good for revision. They're not good for first study. They're very good for revision. Just يعني خلاص like كده كده, because neuro is like a very long block. You will forget some stuff that you want to revise quickly. You can use the Dwight summaries.
And you can also use them for the last few Hamdan lectures, because I remember I and a couple of friends I know
Yeah.
used it for the last few, because he gives the last few lectures are like the specific ones. What I mean are learning and memory, emotions, and cognition. These three, the information in it is it's like a lot of understanding. It's not memorization. So these summaries تبعون لؤي, they really helped us يعني understand what's going on with the lecture,
Yeah.
like really get the information basically better and made it easier.
Yeah.
يعني. So
Yeah.
I definitely recommend يعني.
Yeah.
And yeah.
Right.
Mhm.
Okay.
This is a
So
break
what
for
do
you
we
guys.
mean by this is like a break. They'll send you guys the presentation and you
Yeah.
can just click on the presentation and it goes to one. All right. So what do I mean by enjoy the neuro block? Like I personally enjoyed neuro, like it was the most enjoyable block, even though it was like 12 weeks long. Okay. So why was it like because of stuff like this? Also, do you think that a person who's had his like he was working at a construction site, right? And this like metal rod went through his like jawbone, upper jawbone, through his skull and brain, and then came out to the other side. Yes, spinny
والله يا
stage. Do you
حمزة.
think he lived? Like, do you think a person whose brain is impaled with a metal rod can live? Yes.
They got
Okay,
already.
so
Yeah, they know.
okay,
Yeah.
okay, everything is
Everything is
possible.
possible.
MashaAllah. Okay, very good. Okay, so you can go to the next slide. Strong man, yeah. So basically, this person, mashallah, he survived. You can see him on the left. His name was basically Phineas Gage. So this is like one of the most famous case studies in medicine. This person, everyone was like, "Khalas, he's not going to make it. He's not going to survive." But mashallah, he was. They took out the rod from his skull and he made it. But they noticed later that basically he couldn't hold a job. He changed jobs every few months. He even got a divorce from his wife and had multiple partners. I don't know if that's a bad thing. It's up to you, your perception, if that's a bad thing or not. But like he had like multiple partners, and he couldn't focus. He lost all sense of empathy, and he lost all sense of empathy. And yeah, he was
He
like
was
there was a lot of change
acting
in his
like
social
yeah.
behavior. He couldn't like he had no emotions basically,
Mhm.
and this is how like the doctors came to know, oh, there's parts of the brain that basically govern your personality, and if they're lost, like you won't ever get them back. Yeah, zero morals. That was it's the most famous case. If you watch Dr. House, if you watch Grey's Anatomy, any medical show, there will be a case that is like this because everyone loves to copy this. All right. Hell no. This is just to break this interesting approach to neurology. Like, why is it so interesting? Okay. So approach to pathology. Okay. So you guys have two lecturers in patho. They're Dr. Uban and Dr. Ahlam. You guys are very familiar with Uban. And if you guys don't know how to study for him, you know that he will speak a lot. He will take extra hours and speak a lot about the lectures that you can finish very quickly. But yes, two
Oh,
times speed, three times speed if you can understand. But like what he says is mainly from his like it's useful for understanding, but he will never ask you anything that is outside his slides. All right. So make sure that you go through his slides and memorize it, or at least repeat them twice. Like do study it once, repeat it once. That's more than enough for Dr. Uban. And well, for Uban, if you do not understand it and you want like a good summary for Dr. Uban himself uses osmosis videos and he takes the pictures from osmosis into his slides. So like make sure that you go through like not make sure like if you don't understand it from the lecture, go through osmosis, just type osmosis and the same topic, and you will get like a 10-minute video or a 15-minute video that will summarize the whole lecture and you will understand everything. So you can do this before the lecture or after the lecture, depending on your preference. Like everyone studies differently, but yeah. And then there's the other doctor, Dr. Ahlam. You guys are, I don't think you've had a lecture with her. Dr. Ahlam's way of teaching is like some people don't understand, like the only problems they have with Dr. Ahlam is that they don't understand what to focus on from her lectures. So Dr. Ahlam is like, she knows all the information, but like you can use Pathoma and Boards and Beyonds to make it into like a simpler version of her. So I personally, me, if we have a Dr. Ahlam lecture, I listen to a Boards and Beyonds lecture of that topic, right? And then I listen to her lecture and I understand everything that she's trying to say in simplified version. Okay, because she sometimes uses a bit advanced terms that you don't really know that Boards and Beyonds or Pathoma explains much more like as though they're talking to children. So you'll understand it from there. And Dr. Ahlam brings like she has a lot of pictures in her slides and she will bring the same exact picture in the final or the OSPE. So make sure that you pay attention to the pictures as well as the colored or like the bolded stuff in her slides, because she mainly asked like 99 of her questions out of 100 will be from the pictures or the stuff that she bolded. All right. So any questions about pathology? Do you guys have anything that you want to ask or know about?
I think they're good. We're amazing, man. يعني what can I say? Yeah.
What do we use? Pathoma, by the name, you just use it for pathology. You can use it mainly for Dr. Ahlam. Before you listen to Dr. Ahlam's lecture, listen to Pathoma. Don't memorize Pathoma. Don't memorize everything from Pathoma. Just understand it and then memorize from Dr. Ahlam's slides.
And then
All
you can
right?
use it as review command if you want. But the idea is it's just a resource, both boards and beyond them. They're just resources for you to help you understand her slides. Because honestly, like her slides can be a mess. Her explanation
Yeah.
can be in phrases. So yeah, they just make
Yeah.
it easier.
Basically, her not her, like some people find her disorganized, like her slides and like how she arranges them could be a bit disorganized. So like if you watch Patoma, it organizes it for you, and then you study the lecture. You're like, okay, this part is from this part is from this, and then you move on. All right,
Wow.
moving on. Okay, so this is one of the two new subjects that you have. It's called neurology. For us, it was called clinical. So what is this? So this lecture is basically given by Dr. Al-Kawi. He's basically a doctor at KFS. He's a practicing doctor. He's a very good doctor, mashallah. So basically this lecture is very like clinical. What does it have? The main thing that it has is the clinical presentation. So a patient, let's give me an example. A patient who has Alzheimer's. Okay, so how does he present? Is it more common in males or females? No. Dr. Ali is for psychiatry. We'll come to it. But like, so basically, this is like the signs and how does the patient with Alzheimer's present in the hospital? How does like the progression of the disease go? What are the complications you can have? Is it more common in males or females? It's like details like this about the disease. Okay, so basically neurology, it will look like when you take the lecture, you're like, what am I supposed to know from this? These are all like useless details. That's what your first reaction, at least it was personally my first reaction to neurology, that it would be confusing and vague. But like, again, we had really good VLCs. So what they did is that the lecture, like some clinical lectures or neurology lectures, they could be 80 slides, 90 slides, 100 slides. Okay, and you're like, what do I study? What do I study uh, from these 100 slides or 80 slides? And the thing is, the content that you have to actually study or know is only like 25, 30 slides. So what we did is that we went to Dr. Yaqeen al-Din and we told him, and he agreed with us. We're like, doctor, these slides are too much to memorize along with anatomy and everything. So could you please tell us the important slides? So this was like a very good thing that he did. And he literally highlighted every point that he wanted us to know from the clinical lectures, which shortened the amount of time that we had to spend studying these lectures by a lot, right? So if you can do that, please do that. Tell your BLCs, I think Note is here, tell them to do that. All right. Yeah, our BLCs helped us out a lot in Neuro. So like they really like, mashallah, stepped up. So yeah,
I think yeah.
so
I think that's it for basically clinical, And by the way,
yeah.
the underlined parts here, just so you know, these are
Mm.
repeated parts because we'll get into
Mhm.
how I'm going to tell you how right
Yeah.
now. In pathology, pathogenesis is obviously in pathology, and treatment is obviously covered in pharma.
Pharmacology.
The thing is with neurology is that it mentions some treatment that can be way too detailed. It's something for someone who's a consultant or like in residency. So that's why these like the slides that Dr. Yaqeen actually removed were mainly treatment related slides
Yeah.
because they were really detailed. Yani.
Mhm.
And
Yeah.
because of the whole repetition thing in pathology and clinical, we have this like possible study method that you guys may use. It's something that can help you a lot with going through the content, basically. So, as your first study, what you can do is that you study the pathology lecture and then the clinical lecture that's related to it. So, for example, you took a lecture on degenerative diseases. Directly after you're finished with that lecture, study the clinical lecture for it. This way you have like a much better overview of the disease. You know the pathogenesis, you know the signs and symptoms, you know the features, you know how to diagnose it, and a bit of the treatment. And you can even go as far as taking studying the drugs for degenerative diseases right after it. So that way you have like a full picture of the disease, as your first study. And then when it comes to repetition, don't study the pathology and clinical on the same day. Obviously you can't, but in this study method, you can separate them on separate days, because that way you're kind of repeating your study basically. يعني كأنك you studied it 3 times.
Mhm.
So yeah, this is something that I've tried out. Not, I don't know if I did it in Neuro or not, but I've tried it out multiple
Mhm.
times after that, and it would help me a lot. So you can try it definitely with Neuro, since they're repeated a lot وهيك يعني. And yeah, I think that's pretty much it for this. Moving on to pharma. Yeah, as you can see,
All
by
right.
the way, for pharma, we're going to have a lot of doctors. The only doctor that we don't have advice on that Ijaz will be talking about is Dr. Samah. She's the only one, because she's new. We don't have any proper advice on her. So that will be your job, for you guys to come up with advice for that for upcoming
Yeah.
students. But yeah, go on,
Yeah.
Ijaz.
Yeah. So like, please learn from Dr. Sama, and like as like we're giving you a talk, some of you can give the talk to your juniors on how to study for Dr. Sama. So we don't have advice for that. I'm so sorry, but like for the other doctors, we do. You guys have taken most of the doctors before, like Dr. Hatul, Dr. Dilip. I think Santosh also, and Manan. So the one in general, we have some advice for pharmacology, is that what they do at the beginning of pharmacology lectures. Again, let me take the example of Alzheimer's. All right. So drugs for Alzheimer's. So what the professors do is that they explain Alzheimer's first. Like the lecture will be 40 slides. 15 slides will go explanation of Alzheimer's and like how do they present, how do they blah 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 blah. Blah. They're talking about the disease for 15 slides. And everyone, like me personally, I did this in Neuro. I spent time memorizing about the disease from there, and never have they asked a question to us from those slides, right? And then in third year, one particular doctor told us that, oh, we never asked from those slides, and I was like, are you like okay? Like yeah, I was offended. Like I was like, why did you put it in the lecture then? Um, so
Yeah,
basically, my
some
advice
people,
would
by
be
the
if
way,
you,
some people
yeah,
actually find these introductory slides helpful in a way to like better understand what they took in path, or to just review it very quickly. Okay, so you can use it
yeah,
for that. But the idea is, don't okay, it's a final jai, don't like study those
yeah,
slides intensely. Directly skip
yeah,
to the drugs.
yeah. Yeah, like for me, like now personally, what I started doing is I just skip the introductory slides and I go like straight to the drugs. I'm like, let's go, let's study the drugs, the pharmacology. This is what I'm here for. Okay, so that's one in general about all the pharmacology in neuro. So we have to make tables like we did for POD. Yeah, I'm like in POD, you guys had the Mariam Al-Tayyib's tables, and you edited them, some of you made your own tables. For this one, most of your doctors that teach you are different from what the doctors taught us. So I would advise making your own tables just to organize your information. Yes.
Yeah.
Okay. So neuro compared to pharma, the neuropharmacology is more not in terms of drugs, just like in terms of side effects and mechanism of actions and when to use them clinically. This is the new thing. Like in POD you learn, oh, this is like you use it for broad spectrum, blah blah blah. No, this is completely different in neuro, that you're like, okay, if he's at this stage of this disease, you give him this drug. If that drug didn't work, you give him this drug as the second one. So like it's a bit more different and a bit like more, I think it's a bit harder, just pharmacology in neuro, but it's way more focused. Like it's not very general like POD. So like that makes it easier, but yeah, it is a bit harder. At least it was for me personally. The pharmacology in neuro was a bit harder
Like for
for
me
me
to be
personally.
honest,
Yeah.
the good thing about what I liked about pharma for neuro is that, unlike POD, they gave you like a table with like 5 generations of the different cephalosporins and like a bunch of names, a bunch of bacteria, and I'm like, what
Yeah.
the hell is this? I have no idea what you guys are talking about. But in neuro, no, okay, khalas, it's this drug, this drug, this drug. It's for this specifically. It's for this. It's much easier to understand, in my opinion, for me.
Yeah.
I
Yeah.
liked it a lot better, to be honest, than POD. POD is just a bunch of random names, and I didn't get most of them, to be honest. So
Yeah.
yeah, you get student formulas like what student?
Like we said, the formularies, I don't know what you mean, but do you mean the tables by formularies? So while we wait for a reply.
Different?
Okay, so you guys know what Anki is. It's basically like, if you don't know, it's basically like flashcards. And they're very useful. Like some people find them, like I personally don't use it. Rawan does use it for pharmacology and specific. So like it's very good to revise, right? Because you're not gonna remember you're not gonna remember like the drugs that you take in week 1 and 2 at week 12 and 13. You're not gonna remember what those drugs are. You're not gonna remember it 10 weeks later. Aslan, I don't remember like stuff that I studied in my last block, which is like 2 weeks ago. So like I'm not gonna remember 10 weeks later. So okay. Yeah, so we're not gonna remember what 10 weeks later. So Anki is useful for that because it keeps helps you.
Wait, Peter. I think someone's
Okay.
unmuted.
Uh,
They're muted.
Miss Nora
About this, by the way, I
is
don't. He
unmuted.
never gave us anything for neuro for
Okay.
pharma
Oh,
specifically. No,
okay.
I remember. Yeah,
Yeah.
they did give something for POD for us too, for pharma and POD. But
Yeah.
neuro, I don't remember them giving. Maybe Hatuf. Hatuf, I remember once she told us, "No, okay, I'll give you something to focus on a certain
Yeah.
lecture. So you can try asking them again."
Formulary is basically a table of all the drugs that we're supposed to know. Okay, so again, that goes to the BLCs. Yani, if your BLCs, just ask Dr. Ahmad Yakinuddin. He's very helpful. He's a very amazing doctor. He wants to help the students. If you ask him to ask the pharma doctors as like, oh, can you send us like a breakdown of which lectures have more questions or which drugs to focus on? That's the thing. Like, you don't have a lot of drug names in neuro. You just have a much more about the drug itself. So like you can still ask him. Like I go to Dr. Ahmed Yakinuddin and have a conversation, inshallah, I can help you out. Okay, and now specifically for the doctors itself, Dr. Hatuf, like you guys know Dr. Dilip and Manal, they're very direct, they're very easy. Like just focus on the class and you'll get like a good grade. Dr. Hatuf, the thing is, Dr. Hatuf usually asks from the stuff that she says in class. So if you study only from the slides, I know some people do that, which is completely fair enough if it works for you. But like Dr. Hatuf herself, like she asks you questions from what she says in class. So I would listen to the recording or pay attention in class and highlight it and then study from the slides if I were you. Okay. Dr. Santosh, again, he does the same thing that he has a lot of introductory slides about the disease. I remember for us in musculoskeletal, he gave us like a 40 slide presentation, out of which 25 slides were about the disease and then 15 slides were about the drugs themselves. So like I would skip them and then study the drugs. All right. And then Dr. Dana, she's the easiest doctor to study for in neuro because she will highlight the questions or she will tell you, oh, don't memorize this drug, or memorize this drug, and then she will highlight in green color or blue color the drugs that she or basically the questions that she's gonna ask you. So like just pay attention in class and you're good. All right.
Yeah.
Moving on.
And
Uh,
psychiatry. This is honestly like one of my favorite subjects in neuro. And this is actually taught by Dr. Ali. You'll get to know him better when I think he'll only teach us psychiatry. In second year, he won't teach you anything else on. But yeah, he's honestly like one of the best doctors. Like the way he explains in class is amazing. So right away when you attend, you'll be able to grasp the information much quicker and much better than just reading the slides. And that's another thing. The slides, they barely have words to read. So there's you'll find like his presentations, they're 100, they're like even they're sometimes they go above 100, they're 80, they're 90. وكلهم like they're all pictures and there's minimum words. Okay, don't let that make you get panicked or all. Just attend the lecture. Into what you guys need for the exam is what he says during the lecture. So if you just attend the lecture, you focus on what he says, focus on his examples. His examples make everything much easier. And like write notes with him or just a transcription, go through it multiple times, and you're basically good to go. If you want something as a revision or overview, then I would suggest Boards and Beyond. I would read that like literally, I would more read, watch. I would like watch that every day, like a certain lecture. Each lecture had like a video or something. And they were honestly really helpful. Some people, when first aid, the tables, they're a really good summary. They tell you, for example, oh, depression has elevated of this hormone, anxiety has this elevated, this decreased. Or there's the third option, which is Ibrahim's summaries. Ibrahim is a student from 10th batch. He made really good summaries, mashallah. Like he has so many summaries, but for psychiatry, they were recommended because the slides are so long, and so a lot of people, they don't want to go through them, obviously.
Like Ibrahim's summaries are basically the text part of the lectures
Exactly.
that are not in the lectures, like they're transcriptions for the
Copy
lectures.
paste them basically.
Yeah.
And the thing is, but you won't find all the details in them, of course. That's why they're summaries. And another thing, his lectures might be different than 11th batch, which might be different than your batch's lectures. So if you go through his lecture, you can, يعني, while you're studying for the first time with transcription, you can open Ibrahim's summary on the side, go through the lecture with the transcription. Anything new you find that's not in Ibrahim's summary, you can just add it. And then when the final comes, you can literally just open Ibrahim's summary and you're good to go, you know?
Yeah.
And then that's basically it for psychiatry. Psychiatry is
Yeah.
honestly, it's enjoyable, it's
Yeah,
fun.
and we linked the summaries here if you guys want it. It's right here.
Yeah.
You can see it on the drop. It's our Dropbox. The summaries are right there.
And yeah,
Yeah.
of course, another tip for BLCs, Dr. Ali, because he's amazing, he's like so cooperative. We talked to him when about like his slides and how there are so many slides and what to focus on and all that. He didn't reduce the number of slides, but he did tell us, he sent us like a bunch of things to focus on and what's gonna come. And so I'd suggest you do that. Inshallah, he'll help you. He يعني هو mainly what made him help us was that this all happened during the Corona time, during the end of Neuro. So yeah, that's why he helped us a lot. But يعني inshallah, like he'll be able to help you guys. Come on, يعني.
Inshallah.
Mhm. And now for micro. Micro in Neuro is definitely not as dense as it was in POD. It's a lot easier, to be honest, in my opinion. We had a different command because we had Dr. Botta. We didn't have Dr. Muhabbat in Neuro Micro. But Dr. Muhabbat is honestly like really good. Her slides are, yeah, you guys saw her in Parasites. Her slides, to be honest, they're so organized, they're clear. All you need is just her transcription. You need to listen to her, and she sometimes says what you need and what to focus on. يعني وهيك. And another thing you need to know is that the OSPE will not be just from the lab. She can get يعني, stuff from the lectures. So that's why when you're studying the lecture, you shouldn't be just preparing for the MCQ part. It's going to be also preparing you for the OSPE as well. And yeah, that's pretty much it for micro. Micro is pretty يعني.
Also, one thing about the Dr. Muhabbat, if she says you don't need to memorize this, you just need to understand it, memorize it. Okay. If she says, yeah, you don't need to memorize it, you need to just understand it, memorize it. Okay. Just trust
know
me
everything in
on
the
this one.
slides.
Just memorize it.
Slides are cute.
Yeah.
They're usually short. They're not that long. يعني.
Yeah.
Just know what's in the slides. يعني.
Yeah. Right.
And now immunology and radiology. These two subjects are kind of cute in neuro because they're only one chapter each. يعني. For immunology, Dr. Garwin, his transcription and slides are enough. You don't really need anything else. For radiology, Dr. Jamal, he's going to basically be giving you a lot. يعني his lectures, from what I remember, they were pretty long, and there's going to be a lot of pictures, of course. But usually, what he told us, يعني the important points were always in red, so that's what we memorized. Yeah, we'd go through the slides and just memorize the things in red, and we were good to go. يعني we didn't. Yeah, these two subjects, to be honest, they aren't subjects that you focus on. These are things you go through هيك يعني once, twice, and that's it.
At the end of the block, and when you're studying for the final, you just go through it, just get it out of the way.
Yeah. Like the morning of the exam, just that's it, خلاص.
And you guys know how to study for Dr. Garvin. You put him on YouTube, you put him on times 4, times 5 or 6 if it's possible, and you
That's
finish
if
it
you
really,
open the
really
video
quickly.
أصلا. Like for me, honestly,
Yeah.
I just read the transcription. خلاص, I hate
Yeah.
videos. I only open the video for yaqeen. Okay, other than that, خلاص,
Yeah.
I just read the transcription.
All right.
But yeah, these are pretty easy. يعني inshallah, you guys won't have any problem with them.
Inshallah.
And now labs. So labs, we kind of went over it. I just went over it a bit before. How anatomy, the best way to go at it is to study before you get to the lab. Physiology, yeah, don't waste too much time on it. Definitely review the lab committee slides for OSPE. يعني.
Yeah, inshallah, your lab committee slides are as good as ours. But if they're like not that good, you can go through the past not past. I don't know what past exams are. Let's say the exam committee files. That's what we know. Exam committee files. Make sure 110% you go through exam committee files. I hope you guys know what I say. I mean when I'm saying exam committee
Jazz, I
files.
think they got the idea.
Okay, thank God. All right, so exam committee
Definitely
files.
go through mock exam files by Academic Aid. It's this new committee. I heard the heads and the team is very amazing, mashallah. I don't know them personally, but honestly, I heard they do pretty good work. And yeah, I suggest you go through the mock exam files. For Humam, his Anki is for for Humam, his Anki, honestly, it's very good. Yeah, and I always hear
Yeah.
people talking about how it helped them a lot, especially in POD, and I heard too in Neuro.
Mm.
So definitely use it as a if you're the type of person. Don't feel pressured to use it. By the way, don't just because everyone's saying, oh no, oh use it, use it. Like into يعني, try it. If you liked it, go on. If you didn't, for me personally, I never opened it in second year, no matter how many people told me to open it. I just hated the app so much. But then
Mhm.
in third year, when I opened it, I actually liked it, and I was like, oh, okay, it's not that bad. But yeah, you guys try to test these out. You might find يعني something that you like in هدول question banks.
Yeah.
And then there's Robbins for pathology as well, and UWorld. UWorld, the questions they're not gonna get questions from UWorld like directly copy paste because it's kind of advanced, but they're good for
Mhm.
يعني, testing your knowledge and understanding. So that's why you kind of put it in the end.
Yeah.
And
And we put the link for Humam's
yeah,
Ankis if you want it for Neuro. It's
mhm,
right there. Yeah.
yeah,
And we'll send you the presentation, obviously.
nice.
Uh,
And yeah,
uh,
assessment. You want
all
to?
right. So yeah, yeah, sure. Okay. So PBLs are 5%. Please, please, for the sake of God, don't be absent for PBLs because they're free grades. You just have to say assalamu alaikum and Allah like assalamu alaikum. That's all you have to say. Like that's all, literally all you have to say. Even if you'll get like at least you'll get 4 or 5. You'll get 4%, 3%. It's like free grades. Don't be absent and skip them. If you're absent, it affects your grade much more than just not being good at PBLs. That's completely fine. I'm honestly not that good at PBLs because I learned like from like lectures more than from like by myself. Just attend, okay? TBLs 10%, just attend them, study for them,
Study for
think
them.
of them as like a pre-exam. Like you have one TBL right before the midterm, one TBL right before the final. So make sure that you do like you use the TBLs as like a practice for the midterm and a practice for the final. All right. One very important thing that I want to tell you guys is the midterms, right? The midterm, it is completely fine if you don't get a good grade in your midterm. You can still get a very, very good grade in your path. Me personally, in Neuro, I got a B range in my midterm. Okay, and I was so like I was like, oh my god, this 7 hour, 6 hour credit block, I got a B in the midterm. Halas, yani, I'm gonna do bad in the final. Don't become disheartened that if you get like a bad grade in the midterm because you and I ended up getting like alhamdulillah like a very very good grade in the final. All right. So make sure that even if you do like okay in the midterm, you get a B or a C, it's fine. You can still get an A range or a very good grade in the final, right? Because the final is 70%. Yeah, it's most of the grade. So even if you do okay in the midterm, you can do great in the final, is what I'm
Mhm.
saying.
And finally, words of advice from us to you.
Mhm.
You guys have extra time more than us. Please make use of it. Honestly, like study day by day, make a schedule for yourself. Don't procrastinate anatomy, procrastinate other stuff. Okay, but it's not anatomy.
Don't
Repetition.
procrastinate anything. Don't procrastinate
They're
anything.
human, you guys. They're human, okay?
Okay.
Repetition
Okay.
is key, and definitely
Yeah.
enjoy the block. It's very
Yeah.
interesting.
It's amazing. It's the most interesting block that you're gonna take in second year by a mile.
Mhm.
Yeah.
And
And also trouble your BLCs a lot.
yeah,
Make sure that they help you and you're good. Yeah. If you have any questions, you can ask us now.
what about head and
Anything at
neck?
all? Inshallah, we'll have a separate
Don't,
section.
don't ask me about head and neck.
Yes,
Like,
COVID saved us for head and neck.
COVID, by the way, COVID removed, I think, like 3 psychiatry lectures from our exam, and they removed,
Yeah.
I think there was, I don't know what other lecture, but they actually removed us. Like, it actually helped, okay? We got lucky with neuro, but
Yes.
not head and neck, okay? We got
We got lucky with very good
head
BLCs.
and neck.
We got lucky with very good BLCs. All
Very
right.
true. All
All
right.
right. Good strain, better pull
Better
through.
pull through.
All right. Do you guys have any questions about neuro in general or about the block? No,
Confirm.
it's not harder. There is nothing harder than POD in second year. Don't worry
No, but
about
honestly, I know some people who say they
it.
hated neuro more than POD. I don't know how, but apparently, yeah, some people do. Like maybe they
Okay.
like memorizing more, but yeah, no.
Who's asking? Jude Najude. I don't know how to say that name. I'm so sorry. Did you like MSK in first year? If you liked MSK, you're good, Yani. You're good with Oh, you okay?
I didn't like no, no, I didn't like MSK, and I liked Neuro. Okay,
Yeah,
I
yeah.
don't remember
And
anything from
no,
MSK.
it's not like for like, but like most probably if you like MSK, you will like Neuro also. But like if you don't like MSK, I know some people who hated MSK
But
and they
you
loved
got the A.
Neuro like
But
10 times.
you got the A.
Yeah.
خلاص. You don't
Like
need to
they got the A's, like mashallah, like because Neuro is just explained much better by Dr. Ahmad Yaqeen al-Din, because he explains that you will love him at the end of Neuro. You'll be like, I wish we would have like 2 more weeks, 3 more weeks with you, I think.
find the scam.
MSK final was a scam, it was all physio. Nah, it's not like that. You can ask,
MSK
yeah, do another
MSK
thing. If the BLCs, you can ask the doctor for like, tell us from each lecture how many questions are going to come. And he can give it to you if it's called a blueprint for the exam. But he'll tell you this lecture, he'll ask you 3 questions. This lecture, he'll ask you 5 questions. This lecture, he'll ask you 6 questions.
Yeah, I remember in our final, by the way, they wrote, because I opened the blueprint recently. They wrote in from the brainstem lecture, we got 6 questions in the final. Like usually it's 2 questions per lecture. For brainstem, it was like 2 lectures combined, and we got 6 questions on from it.
Yeah.
So yeah, they focused a lot of the anatomy lectures. They had like 4 questions, 2 questions.
Yeah, it could be obviously different for you. So please just go to the doctor and ask him for the blueprint. If he gives it to you, alhamdulillah, you can use it. If he doesn't give it,
but don't always
bismillah.
follow it, by the way. Like a lot of students,
Yeah.
they told me, they didn't strictly follow the blueprint. Okay, so it's not a sure thing, but it kind of helps you prioritize شوي يعني.
Yeah.
Yeah.
Let's prioritize. If you don't get it, prioritize anatomy first, then physiology and pharma, and then everything else, and you'll be good. Practice questions. We gave you the slide on practice questions and where to like. First is the exam committee files, and these are they'll send you the PowerPoint, but these are like most of like the important sources. All right.
That's it. Any other questions you guys have? Unless you're good.
All right.
Yeah, good luck.
Thank you.
You guys
Thank you so much, guys. It was a pleasure.
Honestly.
Anytime.
Anytime. Yes, pray for us, honestly.
Yes, please. If you can do anything for us, please pray for us. Raywan al-Shir and Jazz. All right. Thank you, guys. Thank you so much.